Hello everyone, welcome back to Pure Balance. My name is Maria. Today I'm here to introduce you to Dr. Naditch. Dr. Naditch has measured clinical outcomes in more than 300 hospitals and outpatient clinics. He was Associate Professor and Chief of Behavioral Medicine at the Bowman Gray School of Medicine at Wake Forest University and an Assistant Professor of Psychology at Cornell University. He has published more than 50 articles in scientific journals and given more than 100 papers at professional meetings where he was often the featured speaker. Dr. Naditch was awarded a PhD with honors from the University of Chicago. He also holds an MA in psychology and an MBA in business from the University of Chicago. Dr. Naditch has a BS in engineering and an MS in marketing from Carnegie Mellon University. He is a graduate of the Harvard University program in strategic marketing management for executives. And here is Dr. Naditch.
Hello, I'm Dr. Naditch. I'm a psychologist and I've been measuring clinical outcomes for the past 25 years. Today we're going to talk about a clinical study at the Pure Balance Chiropractic Center. Now, I came to Pure Balance initially as a patient. I had some back pain and back problems. And about my third or fourth session at the clinic, I noticed that people were losing a tremendous amount of weight. They were weighing patients and the weight losses were extremely extraordinary. So I talked to Dr. Aramian, it's her clinic, and asked her whether or not she'd be interested in doing a clinical outcome study. And she said she would. So this is going to be the result of that clinical outcome study. Now, if we look at obesity and overweight in the United States, the statistics are just extraordinary. 70% of adults in the United States are overweight, and more than 1/3 of the entire U.S. population is clinically obese, according to the U.S. Center for Disease Control and Prevention. Now, why should chiropractors be interested in weight? Well, there's a very good reason. Because extra weight on the lower back pulls the body forward, and that strains the lower back muscles, and that's what leads to a lot of back pain and back problems. And in fact, it doesn't take much overweight to lead to back problems. Just 10 pounds overweight is enough to lead to some significant back pain. So overweight and obesity itself can cause a whole variety of very, very serious problems. According to the National Institute of Heart, Lung, and Blood, overweight and obesity can cause coronary artery disease, stroke, high blood pressure, diabetes, as well as cancer and other serious diseases. So obesity is not a minor problem in the United States. It's an epidemic, and a serious one. Now, here's a question you've probably never asked, and perhaps your doctor hasn't either. As you can see from the next slide here, the question is your doctor's treatment effective? You've got a lot riding on that, but who knows? Who knows, because providers rarely measure outcomes. Now, things are about to change, and change in a really big way. In fact, a tidal wave of change is about to hit healthcare. Healthcare reform is bringing about serious changes, and there's going to be a basic paradigm shift from what has been clinical practice models to what's called evidence-based care. Payers, patients, other stakeholders in healthcare are demanding to see what are the outcomes of clinical services. They're paying for those services, but they have no idea what the outcomes are. Well, nobody wants a report card. And it takes a lot of courage, in fact, to measure your outcomes. And Dr. Aramian was ready to do that. She said, look, let's measure the outcomes. Whatever it is, if it's a problem, we'll change it. I want to know what it is. So we did. So we pulled from existing records 60 charts We pulled them out at random. Well, of those 60, 4 people didn't finish treatment. They dropped out for one reason or another. So that's a 6.6% dropout rate. That's pretty reasonable. So we had 56 patients left. And it's on those 56 patients that we did the analysis. So we coded information out of those patient charts. We coded information like age, like gender, like how much they weighed when they came into the program, their motivation for treatment. We also measured clinical outcome variables. We measured weight on a scale, and we measured blood pressure. Now let's take a look at the first slide up here because this is very telling. If you look at the vertical axis, that's how much weight. And we look at the horizontal axis, and that's the number of sessions, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And as you can see from that chart, weight begins to drop in the first session and continues to drop without let up all the way through the 10th session. In the first session, the average patient weighed 193 pounds. In the 10th session, the average patient weighed only 169.5 pounds. That's 23.5 pounds of weight loss. 2.35 pounds a session per patient. Well, these 56 patients that we studied lost more than 1,300 pounds in 10 weeks. That's pretty impressive. Now let's think about, 23.5 pounds, that's a number. What's it mean? Well, think of it this way. You've picked up a 10-pound bag of sugar, right? It's heavy. So you hold a 10-pound bag of sugar in your hand. Take another 10-pound bag of sugar and put it on top of that. Well, that's really heavy. Well, don't stop there. Take another 5-pound bag of sugar and put it on top of that. That's very heavy. Well, put it on your shoulder. What would it be like to carry that weight day in and day out? Well, that's the extra weight that the patients at Pure Balance were carrying before the program. That's how much weight they lost that they don't have to carry anymore. Well, that much weight, loss reduces significantly risks for heart disease, reduces risks for high blood pressure, for stroke, for diabetes, and for cancer. So all of these patients have significantly less healthcare risks for a lot of very serious diseases. So one question asked is, well, these results are impressive, but do you get the same thing for men and for women? Is it mostly the women who are losing weight and not the men, or vice versa? So what we did was we pulled out the men and the women and we looked at them separately. You can see from the first slide here, we're looking at women. And it's basically the same thing. From the beginning to the end of the 10th session, there's a steady drop in weight loss. And if you look at the next slide, for men, it's the same thing again. Men lost weight starting at the first session and never stopped losing weight until the last session. Women lost an average of 23 pounds. Men lost even more, an average of 25 pounds. Well, it doesn't matter how old you are. I mean, maybe it's the old people who are losing weight, or maybe it's the young people who are losing weight, but not the old people. What difference does it make how old you are? Well, fortunately, Pure Balance treats a wide variety of age groups. And the patients in this randomly drawn sample, some were in their 20s and some were in their 80s. So we had quite a range of ages to look at. So what we did was we divided the ages into 3 more or less equal groups. People who were 20 to 39, people who were 40 to 59, and people who were 60 to 80. Now let's look first at women on this next slide. Well, first of all, we can see that women lost weight. It didn't matter how old they were, regardless of age. If they were 20 to 39, they lost an average of 22 pounds, 40 to 59, 20.6 pounds, and 60 to 80, even more, 25.5 pounds. Look at men, the next slide. Same thing. High, medium, and low weight, very significant weight losses in all 3. So we can conclude from that age doesn't make any difference. That people lost weight in this program, whether they were in their 20s or whether they were in their 80s. It didn't make any difference at all. Well, how much did it matter how much you weighed when you came into the program? I mean, suppose you weighed 400 pounds, or suppose somebody else weighed 130 pounds. Would you expect the 400-pound person to lose more weight than the 30-pound person? And maybe, these results are just a few really heavy people losing a lot of weight, and the people in the middle and the lower weight people, they're not losing weight at all. So let's look at that. Let's look at how much people weighed when they came in. And we divided that into 3 equal groups. People who weighed 209 to 313, 185 to 199, and 141 to 79. 3 groups, high, medium, and low weight when they came in the program. Well, people lost weight. It didn't matter how old they were. All 3 groups lost a significant amount of weight. But we did find, as you would expect, that people who were the heaviest people lost more weight. So the heaviest people lost an average of 32 pounds, but the medium people and the low people also lost 25 and 22 pounds. So everybody lost weight. It didn't really matter how much you weighed. It wasn't just the heavy people losing weight. It was everybody who was losing weight. Now, we know that overweight is a risk for high blood pressure. And we know high blood pressure is a really serious thing. So the logical question is, if you lose this much weight, if you lose 23.5 pounds, does your blood pressure actually drop? So we looked at that. And the answer was absolutely yes. That patients who lost weight experienced very significant drops in blood pressure. Systolic blood pressure, which is the blood pressure when you're active, dropped an average of 7.7 points, which is a lot. And diastolic blood pressure, your resting blood pressure, dropped 7 points, which is even more. So there was a significant drop in blood pressure of people who lost weight in this program. Well, is it the men or the women who were losing the weight, or who were losing the blood pressure, getting lower blood pressure? Well, let's take a look at that. So here you can see men. And we're looking at men's systolic and men's diastolic blood pressure drop. And you can see for both, it's the same thing. Men are having significant drops in both systolic, 7.5 points, and diastolic blood pressure, 7.4 points. Now look at the next slide over here. Look at women. It's the same thing. Women had significant drops in systolic blood pressure, 7 points, and very significant drops in diastolic blood pressure, 7.7 points. So we can see that in addition to losing a lot of weight, people in this program also had very significant drops in blood pressure. Well, what does that mean? Well, the Mayo Clinic tells us that lower blood pressure reduces your risks for coronary artery disease, enlarged left heart, arterial damage, heart failure, stroke, dementia, cognitive impairment, kidney failure, eye blood vessel damage, optic nerve damage, sexual dysfunction, bone loss, as well as trouble sleeping. So by losing weight and dropping this much blood pressure, the patients in this study significantly reduced their risks for a variety of very serious diseases. Well, another question is, some people came into the program not to lose weight, but because they had back problems. I didn't come to the program to lose weight. But other people came into the program primarily because they wanted to lose weight. So they had different motivation. Does it make any difference? Does it make any difference whether you came into the program to lose weight, or whether you came into the program to reduce back pain? Well, oddly enough, it doesn't make any difference at all. That the weight patients had, as you can see from this chart, had significant drops in blood pressure, and the chiropractic patients lost even more weight. I mean, not blood pressure, but weight. So the weight patients had significant drops in weight, and the chiropractic patients also had significant drops in weight. So the motivation for treatment didn't make any difference. So what conclusions can we draw from this? Well, the patients at Pure Balance Clinic had very significant drops in their weight, had very significant drops in their blood pressure, and it didn't matter how old they were, it didn't matter whether they were males or females, it didn't matter how much they weighed when they came in the program, and it didn't matter what their motivation was. They all experienced those results. Well, another question you could ask is, these are impressive results, but how do these results compare with other programs? Fortunately, Duke University did a study of the major commercial weight control programs. So we were able to get that data and compare that to the data for Pure Balance. And you can see that in the next slide right here. It's pretty dramatic. People who went through Weight Watchers lost an average of 5 pounds. People who went through Jenny Craig lost an average of 16 pounds. The people who went through Pure Balance lost 23.5 pounds. Pure Balance far outstripped Weight Watchers and Jenny Craig in terms of its ability to help people lose weight. And Duke also looked at a whole variety of prescription drugs that are generally used for weight loss, across the bottom of the chart here. And again, we compare the effect of each of those prescription drugs and taking no prescription drugs, but being in the weight loss program at Pure Balance. Again, Pure Balance far outstrips any of these prescription drugs. With no prescription drugs, there's more weight loss in Pure Balance than using any of the major prescription drugs currently in the market for weight loss. As you can see, patients at Pure Balance Chiropractic lost more weight than patients at any of the currently available commercial weight loss programs. So if you'd like any more information about the study or about Pure Balance or about clinical outcome systems, you can call Dr. Aramian, and you can get her at the website at www.purebalancechiro.com, or you can get in touch with me, Dr. Murray Naditch, at Clinical Outcome Systems at www.clinicaloutcomesystems.com. Thank you very much. It's been a pleasure to be able to speak to you tonight.